Thank you, everybody, for waiting patiently. We're starting a few minutes late. This is the Board of Health meeting of June 3rd, 2024. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Healy's March 29th, 2023 signing of the Acts of 2023, extending certain COVID-19 measures adopted during the state of emergency, suspending certain provisions of the open meeting law until March 31st, 2025. This meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that any persons who would like to listen to this meeting while in progress may do so by calling the number 1-508-945-4410 and the conference ID, which I don't have here. I don't have the conference ID number. I will, once I get it, I'll put that out there. I apologize. While this is a live broadcast and simulcast on Chatham TV, Channel 8 and 1072, despite our best efforts, we will not be able to provide real-time access. We will post a record of this meeting on the town's website as soon as possible. Also, please be aware that this there is a link on Microsoft Teams through the link in the posted agenda that you can link on to attend the meeting. Okay. The conference ID number is 600-861-787 pound.
It's on the screen too.
Oh, great, it's on the screen. So now I'm going to turn the meeting over to Dr. Noble Hanson, our chairperson.
Thank you. It shall be the policy of this board to conduct its meetings under the open meetings law so as to encourage public participation whenever time permits and as part of agenda item discussions. And this week we have just one item. It's a focus group for Chatham Community Health Needs Assessment. And I will turn it over to Judy shortly, but I'll read just an introduction on the group discussion in the flyer that they've sent out. The Barnstable County Department of Health and Environment and the local health departments in Brewster, Chatham, Harwich, and Orleans are working with a research firm to conduct a community health needs assessment of the towns on the Lower Cape. A piece of this assessment involves focus groups, which are discussions that provide an opportunity for community members to share their ideas, thoughts, insights, and concerns about community health and related service needs. Okay, so I'll turn it up.
Do you want to confirm we have a quorum?
Oh, yes. And then we confirm we have a quorum. When I call your name, please say present. Carol Boyce.
Here.
John Beckley.
Present.
Ron Broman.
Here.
Dick Edwards.
Present.
And our alternate, Carol Boyce.
Present.
Good.
Carol Gordon, yeah. Okay, so we have a quorum.
So this is going to be a little bit different, as you can see from our usual Board of Health meeting. Just to give you a little more detail, the health agents in Chatham, Harwich, Brewster, and Orleans, and did I miss anybody? Chatham, Harwich, Brewster, and Orleans. Just the four towns decided to look at what the needs for our community are. We have a local public health on the Cape, a public health excellence shared services group, which are most of the towns on the Cape. But and we each have a little bit of money to spend every year, and we wanted to see what the needs were and the best ways to spend some of that money and pool that money to, and find out again what's on people's minds, what they think we could do better, what the communities are offering, what they're not offering, and this is part of a whole project. The focus group today is just one part of it. We will also be issuing surveys. And the group we've hired are doing all types of research as well. So I just want to introduce you to Nicole Hallis, who is from Crescendo Consulting Group, and she's the research manager and is going to be the facilitator of this this program. So welcome.
Thank you very much. So as Judy mentioned, my name is Nicole Hallis. I work for a company called Crescendo Consulting Group. And I'm here today to talk to you all as the Board of Health, community members at home and who have joined us in person, to really get your thoughts about the community, the needs that exist here, resources that are available to people, and resources that aren't available to people, to try to figure out where some of those service gaps exist. So how today will work is I'll ask a series of questions. It can definitely be more of a discussion in terms of, you don't have to just answer what I have said. If somebody else in the meeting says something, feel free to respond to that. This is a safe space to share opinions. I would just like to say that. So I ask that the conversation be free of judgment. Some of the topics we touch on today, like mental health and substance use, can definitely have some stigma attached to them, but this is a safe space. Everyone has different experiences, so please be respectful of that and each other. And that being said, we can get started here. So my first question, I always like to start off with something positive. So for the people that live in Chatham, access services here, what do you like about the community? What are some of the strengths of this community? What keeps you here?
If anybody online would like to answer any of the questions, just please raise your hand and we'll recognize you. Anything?
There have to be some positives to living in this beautiful community.
Well, our taxes are fairly low. I like that. And I think our government is well-run.
Those are important things.
I see a hand up, Diane Nash. Diane?
Hi, I just want to say, as a resident of over 30 years, I would say it's just the thing that really I feel strongly about is the sense of community. People support each other in their time of need. The community really comes together for that. And I think anyone who's been affected in any kind of way, whether it's physically, emotionally, anything, they can agree that Chatham just does a great job of pulling together.
I see another hand, Jess Rogers.
I just wanted to piggyback on what Diane had said. I grew up in Chatham and couldn't imagine raising my kids in another community.
That's great.
I think that Chatham is a small enough community, especially in the winter, where people know each other, and the town services can be extended around pretty easily and have access to most people, although I think access to some of the elderly who are by themselves would be a question.
I don't live in Chatham, but I've worked for the Board of Health here for 20 years, and with the staff here in Chatham, and I think one thing that the town does well is we try and communicate within the departments as to what issues we see with certain townsfolks and ways to all work together and not work in our own silos, so that we can help people, without. We can help people and not be working separately and working against each other. And I think the communication within the departments, the police, the fire, the Council on Aging is really great.
That's wonderful.
John?
Yeah.
And I know this may sound trite, but I like the absence of partisan politics in this town. I don't know what political affiliation our selectmen have. I don't care. And I just like, with what's going on in this country, all the bitter partisan bickering, I like the fact that we don't have that here. We don't see that. I'm sure we have differences of opinion, but it doesn't get drawn into a partisan political fight.
Yeah, absolutely, go ahead.
I've lived in Chatham for quite a while now. One of the problems I noticed when my wife and I first moved down here, we lived off Cape, was we couldn't find a doctor. And we still have not been able to find a primary doctor. You know, everybody's taken care of. So we ended up taking out a thing called concierge doctor, which is very, very expensive. But it's a doctor who's, you call him, he calls you back within a short time. You gotta get in there, they squeeze you. It's worked out for us because, you know, we've been able to, but it becomes to be very, very expensive and fortunate, you know, my wife and I can afford it. But imagine how many people in this town just don't have the doctor. You know, if they need it, they have to go into the hospital maybe or somewhere else. I think that's one of the big problems we have down here.
If you want to speak, Is anybody in the audience who wants? Anyone in the audience who wants to speak, please go up to the podium.
Hello, my name is Pat Burke. I've lived in Chatham full-time for about 7 years. We've owned a house here since '92. I am a Shine Counselor at the Chatham Council on Aging. I'm also on the Board of Directors of the Chatham Council on Aging, but that's not why I'm here. But what you just said about a primary care physician is such a need here. I have people come in to see me in Shine almost on a weekly basis that, due to financial needs, we're directing them to Medicare Advantage programs. And I don't know how much you know about those programs, with the exception of the crazy TV ads. But in most of those programs, you need a primary care physician. So what happens to them is they get assigned a primary care physician, and then they never see the primary care physician. They'll see a nurse practitioner or a physician's assistant. And I have, believe me, I have nothing, nurse practitioners are great, physician's assistants are great. My concern becomes, as people age, their healthcare needs often become more needed, and they'll have something critical happen to them, and they won't have anyone to go to. It'll be a doctor they've never seen. Much like I have a concierge medicine doctor off Cape because I've known him since he was a resident, so we've happened to stick with him. But I feel that's a really big concern, and I know it's not just Chatham, because I see people in China from all other towns that come and see me, and I don't know what, if anything, any of us can do about it, but I think it's important to bring it to the forefront. Thank you.
Yeah, just
Yes, Noble.
along the Council of Aging, the number of services that you provide, but you
Yes.
mentioned Shine, and I think that's Medicare advice to
Yeah, we do Medicare and Mass Health.
and Mass Health, and I think particularly among the elderly, we have a lot of elderly, they don't always have all the information, and I visited you, and these programs change year to year.
Yeah.
The co-pays jump way up. If an elderly person does nothing, it automatically renews, and that fee could have jumped way up and they wouldn't really realize it. And then there are some opportunities, like in the Part D prescription plan, there was one good opportunity where you could very inexpensively get your Part D, but only if you looked at it. There's a website, but your service is really a big help.
Thank you. And I think that when I speak to people, I try to let them know that open enrollment is October 15th through December 7th, which I think is like kind of stuck on my brain. But I tell people to come back because things change every year. And I've had people come to me, just as you said, Noble, that are paying a very minimal amount, don't bother to look at their mail or whatever, and it goes through the roof. That happened last year to a couple of programs. Plus, I've had people come into me who don't bother to get the programs, and there are penalties. And unfortunately for me, I'm the one who has to tell them that they have to pay either a Part D penalty or a late Part B penalty, and some of those can be quite significant for people. And there are many people within our community that I think we need to remember that have greater health needs and do not have the funding to have concierge medicine. And many of those people, we are fortunate right now because we have a great new program called the Medicare Savings Program that the limits, there's no asset test, and the monthly limits have gone way up. So many people are eligible for those programs, and we've been seeing a much greater utilization of those. I'm sorry, I'm not trying
No,
to
that's
take
fine.
up your
But I
whole
think
meeting.
promoting and getting information out to particularly elderly, but the broad population in Chatham is something that would probably really help, because I suspect a lot of people don't know what services you are providing.
I think we put it in, all of that information, Anna Mylan, who's our production person, usually puts in the flash. I mean, we have, I've done Chime presentations with the person I work with, so we do a lot of that. But, you know, there's a lot of information that's out there. All of the information, unfortunately, isn't correct, and you're right. I mean, I'll have to take a look at the flash a little closer and see how much is in there.
Go ahead, Rick.
Thank you.
Yeah, I have a couple of comments to make. First of all, about the physician availability. You know, my wife and I moved here about 4 years ago full-time. We both found a physician within 2 months at Outer Cape Health Services and in Harwichport. And unfortunately, a year later, that physician left. But I'm now assigned to a nurse practitioner who is doing a very, very good job. And I'm afraid if people are not going to go to a place like that because they only want to see an MD, and they're going to spend money to see a concierge physician who, in many cases, in my experience, are not that great, but make a lot of money on these concierge fees. I recommend that people really look into Outer Cape Health Services. You know, I was in the hospital on emergency room visit last Thursday, stayed overnight, and today I get a call from Outer Cape Health Services that they saw that I had been in the hospital, and they'd be happy to see me tomorrow if I want to come in for a visit or do a telehealth visit. Now it's going to be with a nurse practitioner, but there's nothing wrong with that. And as we go forward, nurse practitioners and physician's assistants are going to be performing more and more primary care. And if people are reluctant to go there, they're going to be in big trouble. And that the quality of care is not really any different from what I can see, other than the physician has to spend a lot more time dealing with insurance problems and the nurse practitioner can actually sit there and talk to you rather than just typing on a laptop. The second thing I wanted to say is that I've been amazed at how good the fire department services are in Chatham, and the ambulance services, and the way they've got it set up. You're going to get a free transport to the Cape Cod Hospital or wherever you have to go, and if their 2 ambulances are in use, then they have agreements with the surrounding towns. So that I think the ambulance services here are absolutely spectacular, and you're not paying through the nose for private ambulances.
I would say that that's very true, and I was trying to say that before, that the fire department, the EMTs in this town are very caring, very professional, and as I said, they communicate closely with the other organizations in town that, so we can all find help for people in need. And I agree with you about the Outer Cape Health. We do have Outer Cape Health as a community health program funded by the federal government. They were incredibly resourceful and helpful during COVID, and they are a great source of information and help and healthcare in our community.
I had trouble getting in there, by the way. I went and I submitted my application for my wife and me. Months go by. I don't hear anything. Basically, they were full, and they were turning away people. And then I finally got a call from somebody who was talking about giving me a date to come over, and I said, well, I'm in my car, can I call you back so when I have my calendar? And I called them back, and then I never got a call back. So I'm aware they are what is it? It's a code for them.
I don't know, they're a community health center,
Yeah,
federally funded.
Federally funded. FQHC is what I was trying to think.
Okay.
But I know that, I've heard good things about them, but they were not taking new patients.
Yeah, I mean,
a year or two
I'm
ago.
sure like any, everybody's stressed for services.
And that's not the first time that I've heard it. There's a pattern I hear. It's when new people come to the Cape,
Yeah,
they discover that they can't find a medical home. And in some cases, they continue to go to the doctors they were going to an hour and a half away. They don't want to lose their medical home. And then we used to have Emerald, right? And that was based in Harwich, and that was a growing. But I don't know. It seems to me, from my perspective, that Cape Cod Healthcare needs to do a better job creating more openings for medical homes. Unless there's things that are out there that the average person doesn't know about. But that's my perception, at least, that it's hard to find a medical home. And what happened in my case was I had a medical home, and then they weren't making money, so they decided to transform into a direct care primary practice, i.e. concierge, right? So now I'm paying every month, like you, and it's getting hard to afford, quite frankly. I'm
Well,
paying every month.
part of the problem, and we'll probably talk about this later, is the housing problem. And I spent 24 hours at Cape Cod Hospital last week, and talking to the nurses. They have all these traveling nurses that are coming in and staying in motels and hotels because they can't hire nurses because they can't find a house. We have this terrible housing shortage. If you're a nurse making $100,000 a year, you can't buy a house. And the rents are outrageous. So they can't, the staffing, that's part of the problem here. But I guess I'm just lucky because, I needed a cardiologist last week, and I've got a cardiology appointment this month in
you have one.
Chatham.
Pat, did you have another comment?
I just wanted to say, Outer Cape Health Services is wonderful. They do more than most places I've worked. I'm a nurse, and I've been in healthcare a long time. And I didn't want you to think that I in any way would disparage physicians, assistants, or MPs, because I agree 100% with you. They are the new future of primary care medicine because there are no primary care doctors. And you were lucky in getting the 2 months, but I think it's important for you to say the follow-up, because the follow-up is the key. That's the key to keeping people out of the hospital. If you don't go back in and see somebody within 24, 48 hours after discharge, you're going to end up back there, and you won't have the follow-up, And I'm really not trying to take over your meeting.
No, that's fine.
Thank you.
So we've talked about primary care physicians and a medical home. What about more specialized healthcare, like if you need a cardiologist appointment or an eye doctor or even a dentist? How easy is it to find more specialized care on the Cape, or do people have to leave and go up towards Plymouth or Boston even?
Well, again, my experience has been quite good. We needed ophthalmologist, and we got an ophthalmologist, and everybody's on Ansel Hallett Road in Yarmouth. So I got a dermatologist on Ansel Hallett Road. I got an ophthalmologist on Ansel Hallett Road. Fortunately, I got a cardiologist here in Chatham. But they're there.
Dentists can be hard to find.
They are around.
Dentists can be hard to find.
Dentists, I got a call the other day that I needed a follow-up appointment at my dentist in East Harwich, and they've been closed for a year and a half. But the company keeps sending these automated calls. They closed, but there was an ad in the paper the next day. There's a new Cape Cod Dental in Harwich and Eastham that's taking new patients. Now, she's a Harvard-trained prosthodontist, so be aware that when you go in there, you're probably gonna need 3 crowns. But you can see a dentist within a week at Cape Cod Dental.
That's good.
My experience has been pretty good finding specialists, and if you know, if there's not someone here, they will refer you off Cape to Boston and other places. So I haven't had sometimes you do have to wait for appointments. There's waiting times for some of these specialists. It can be long.
Yeah, I agree that the specialists are there's a lot more access to the specialists than PCP. PCP is really the problem. And, you know, when the new ones come, they get sort of overwhelmed with patients and loads, and then they seem to be unhappy and they leave. So it's a big, and they have to come mainly through Cape Cod Healthcare or something like that, I think, a big organization.
Why do they leave?
Well,
I think
64% of Chatham is.
They get overwhelmed with the patient load and the need.
And everybody's on Medicare.
And everyone?
Everybody's on Medicare, and they can't make much money
Because of the
from Medicare.
Right.
So if you've got the median age in Chatham is 64 and a half years, if you come in here as a PCP in Chatham, 80% of your patients
You
are
don't
gonna
have
be
the
on
right mix.
Medicare.
You don't have the right
You don't
mix.
get a good mix.
But I suspect they're hired through Cape Cod Healthcare.
Are they salary?
Most of them aren't in, their own private practice, but. Back on the police and fire, the reverse 911 is, which department does that? That's a good service that I think people don't know about, where you police,
Police, yeah.
they come in and they put a lockbox on your door with an access key, so that if you're not awake, or you fainted or something like that, or you're away.
That's fire, I think.
They can come and they can get in your house and have access instead of breaking the door down, but that's a very good service that I don't think is widely known.
I also,
I think it's reverse 911, isn't
I
it?
think the police do like health
we have
checks
that.
with doing that too.
Yeah,
And
we
in the morning,
have-
they'll contact certain people.
Yeah, there's a special
What does that mean? You can
services.
sign up for it by going to
Yeah.
the police?
There's 2 lists. There's a reassurance call that people can sign up for. They have to call in every day.
I don't think that's widely known.
And they try and get it out there, but yeah, that's definitely a great asset in our community. And also, there's a special assistance group of people, so if we're getting a snowstorm or a hurricane, they will call everybody on that list and see what their needs are.
Make sure they're okay.
Yep. So
But
those are
that's-
2 good programs in
Would be a
Chatham.
tremendous help, yeah.
Yep,
I don't think it's widely known.
Some of these good programs are, right, are hidden.
yeah. We need to try and advertise them more.
Somehow through a town newsletter.
Yeah.
Feature
The
story.
COA works hard to get people on those lists, and
that right?
as people, show up with issues, and then we get them then. But it's not just for people with issues. Anybody who lives alone that wants to have someone check on them can be on it.
And transportation is good. The COA provides good transportation to elderly people. I have a friend who needed to go to Cape Cod Hospital for a follow-up visit, and you have to give them about a week's notice, and they set you up. They took him to Cape Cod Hospital, and then he wanted to go out to lunch at a restaurant in Yarmouth, and they dropped him off at the restaurant, and I drove him home. So it's
Well-
it's amazing what they'll do.
However, 2 cents. If you want to talk about transportation, we should discuss the challenges associated with people who live on Cape Cod getting up to hospitals in Boston because they need to see a specialist or somehow. I mean, when I had a detached retina a couple of months ago, when I was told, you got to get up to Boston, ear and eye, and you got to do it today. All right, who's going? I can't drive. My wife doesn't drive in the city. So how am I getting up there? Well, first day I went up, I got my brother-in-law to drive me because he happened to be around. And then they said, you gotta come back Monday for the emergency surgery. No brother-in-law. So how am I getting up there, right, for emergency eye surgery? So I ended up hiring a private driver, like a limousine driver.
It's expensive.
He had to go up with me, sit and wait with me, wait for me to be out, and then drive me home. Bill, $450, tip, $50. Total cost of this deal was $500. Now, how many times are you gonna do that? Right?
Well, if you know when you want to go, the way to go is to take the Plymouth and Brockton bus to South Station in a cab over to Mass General. It'll cost you about $50.
Not with a
I think that,
Well, no, I'm not that, not with that.
I think there
But
is
that's a way to get
definitely
there.
a
That's the way
barrier.
my father used to get to the Mass
that right?
General every time he went.
Okay.
I think there's definitely a barrier to care there. I mean, transportation, I mean, if you have the means, you can pay somebody to get you, but there's many people who don't have that kind of means, or may not even have the mental capacity to put together that type of
plan.
trip or a
Plan,
plan.
yeah.
Not only to go to Boston, but even just to get to Hyannis. So that's, I think, often a problem with people getting, especially mental health help, or substance use help, getting to meetings, getting to appointments, et cetera.
I do know that RTA does transportation to appointments. You can call in and get an appointment. They also do to Boston. They do take people to clinics. So the RTA is involved there also.
RTA stands for,
Cape Cod Regional Transit Authority. My husband works for them. So they do special trips too for people for appointments. And it's fairly cheap. They also take a lot of workers to work in the morning, my husband says, so a lot of people are regulars, workers going back and forth. So it's fairly cheap, it's $2 to ride.
well, how come nobody knows
Free, and
this?
seniors are free, I think, on Fridays or something.
Yeah,
So,
who knows this?
I know.
So
It's Cape.
part of the challenge is we may not have what we need. We may also have what we need, but no one knows what we have. And how do we make it so that everybody in town is aware of certain opportunities?
Wouldn't that be something that the Chamber of Commerce should have for when people move in, that would be included in the information that they give you? I would think that would be a good place to start.
Yeah, but you only move into the town one time.
Well, yes, but
Right.
at least you'd have that resource, a number to call anyway.
Yeah,
Even if it does change,
Right.
It would be a start.
right.
So that is one of my questions for you all, for community members, is how do people learn about services? Like, is it a town website? Is it social media? Is it word of mouth? How do people learn about what exists? Because it does sound like there's services here, but they're maybe being underutilized. So how do people currently learn about what's out there?
I think a lot of it's word of mouth, or if you have something, you go see a specialist, and then you ask a friend, and someone says, well, I did this, or, I went to this person. So I think a lot of it's word of mouth.
It's hit and miss.
I think we're starting to use social media more and more in town. And we do have a newsletter that goes out to those who sign up for it every Friday called the Main Sheet that has a lot of information. We try to keep that fresh and pertinent every week. These are topics that we could put out there, so it's good for me to hear because I can perhaps focus some of our ideas to them, to the person that puts that out every week. But it's true, getting the information out there can be difficult. There's Facebook pages, there's word of mouth. Some of those Facebook pages are kind of word of mouth type citizens talking to each other.
I don't know much about Chatham's visiting nurse situation, but I would think, they could be helpful too. If you have a medical problem, and you have a question like how I get to Boston, and you call the visiting nurses, they might be able to help you with information? No? If not,
Well,
it would be something they probably might be.
we
encouraged
have
to
a
do.
town nurse who works for the VNA.
We do.
We do, yep.
What does she do?
She follows up, she gets cases referred to her, and she goes to visit, she does home visits. She works with my group that meets monthly.
How do you get access to her if you need it, if you think you need it?
They can contact me, or they can contact the Visiting Nurse Association of Cape Cod. They can contact the COA. We all have access to her, yeah.
In another life where I used to live, our county had what was called an INR, Information and Referral Hotline, and it was a phone number. It was like I know just enough to misspeak it, but there was like a 211 or a 4. There was a particular phone number anybody in that county could call and be linked in with an INR, which is information. And that person who answers that phone would have a database on every possible topic.
Right.
And then they could zoom in and say, okay, here's what I have for that. You know, it's bereavement, if it was mental health, it was depression. They would code in that question, and then it would give them a list of services and phone numbers. Now, I don't know if they do that in Massachusetts. Are there any statewide programs or services that organize around that concept?
There is the 411, which I think is around mental health issues you can
Okay.
call
Okay.
in the state. The Barnstable County also has a hotline that they started during COVID, but people still, I don't think they're actively being manned, but people can call there and their nurses will respond and help people find services as well. The Barnstable County nurses are actually doing their own needs assessment for nursing needs on Cape Cod. So that information will probably be coming out around the same time as we put this together, so.
Could there be a section on the town website? I mean, it has the different departments, health department, but a community health portion of the town website. They just listed all these various things in the town nurse and the Council of Aging activities, but just listed it all out, and somebody could go there and become aware of all those things.
Yep. We can look at what's on
Something
there,
simple.
and we're actually kind of
Where you
looking
can-
at our
when that thing
website
comes up,
now,
you can
so,
actually get to it.
yep. Yep.
I had another thing about, talking about primary cares. There's an internet access that, like Cape Cod Healthcare has MyChart. And I think that, I mean, I'm not that swift on the computer, but it can be very helpful, and I suspect a lot of people don't take advantage of it, especially elderly people, but you can get, that's the easiest way to get a simple question asked of your primary care is a message on your MyChart. And they'll come back to you that evening or the next morning, and instead of calling the office and going through all that.
Assuming you
And
can
there's all
find your way on.
And
Well,
you have
that's
a-
it.
and assuming you have a primary care physician.
Right. But it's also a matter of education. People aren't that handy with computers, don't look, but it is a very helpful thing.
It's assuming the PCP is part of Cape Cod Healthcare.
Well, that's the one,
Because if
all the
they're
big
not
systems
part of
have,
Cape Cod,
they won't have it.
they're not on my chart.
It's a different, yeah.
But there's other ones too,
Each hospital has their own.
yes.
Epic, what's this thing called, Epic?
What about mental health care in terms of getting therapy? If somebody needs, having depression, anxiety, is it easy to get a therapist appointment?
Okay. I'm a nurse practitioner and I provide behavioral health. And there's a lack of psychiatrists on Cape Cod. So if someone needs a psychiatrist, trying to find one is almost impossible. For depression, anxiety. I think the Duffy Center specializes in more addiction, drug abuse, alcohol. But if someone is just depressed or anxious, who are they going to go to? So they end up going to their PCP,
Where?
if they can get a PCP.
Oh, PCP, oh. Well, who does the PCP refer that patient to then?
They prescribe.
Oh, drugs.
They'll prescribe the antidepressants or
Right.
anxiety medication.
Okay, all right.
I think there is a need, as I agree with, for health, mental health care professionals on the Cape. Town of Chatham, and I can see our new mental health coaches online, but we have hired somebody. I'll let her speak. Diane, would you like to speak?
Oh,
You're muted.
There we go. I just wanted to introduce myself for those of you who may not know who I am or what my new position is, but I'm in my 4th week here as the new behavioral health clinician for the town of Chatham. So a lot of the stuff that you've just been talking about is the hope for the town that in my role, I will be able to assist our community members in connecting them with the services. I work very closely with the Chatham Police Department, which is where my office is based out of, as well as the Council of Aging. We have an outstanding outreach worker, Carrie, who's on the call right now with us as well. So I think I'm very hopeful that this position is really going to start touching on the needs of what you guys are talking about in terms of mental health, medical, all the things that the town doesn't even know exists, basically.
can you give us your name again and the access, phone number, or how would somebody access you?
Sure. My name is Diane Nash, and I can be reached at 508-945-5107. And you can always leave a message. Anyone can call the Council on Aging, and they can get a hold of me. I also work with the police, so if there is a crisis call that they need assistance with, I either go with them to the call or I meet them at the call.
So you are behavioral health?
Clinician, yes, I'm a licensed social worker.
Okay, thank you.
And so you've only been here for 4 weeks, but with that little bit of experience, what can you tell us about the situation in Chatham in terms of behavioral health and the needs and what's going on and what's not going on?
So the first thing, as I said, I've lived here for many years, and I can tell you that I am very impressed with the town employees here. As Judy had stated earlier, everyone has just been so supportive. Everyone works as a team, and I think that that's why perhaps the community doesn't know a lot of what's going on, because everyone in town does such a good job of addressing the needs. I think that for sure mental health and medical, that's the majority of the calls that I have worked on, especially with the Council of Aging. So it's tough. I mean, I'm gonna have my work cut out for me, but you know, at least it's a start. And you know, I think as we get word out that my position is here, hopefully we'll see more people utilizing me.
Now, do you coordinate with the school system and their needs for, you know, behavior and mental health?
So we still are hoping to fill that position for the child and teen position. So that's you know, in progress. We're hoping to get that filled in the near future. But I mean, certainly if there was a crisis, I would be called to that as well in the interim.
Where's the funding coming from?
The town, last year had put the money in, voted.
Into the budget.
Into the budget for
Good.
2 mental health therapists, counselors for the town, and it's
Very good.
amazing. So,
Thank you.
Thank you.
thanks, Diane.
Oh, I have a question. Do you have psychiatrists on the Cape taking patients, new patients?
We do. So I have connected, part of what I've been spending a lot of time doing is just making connections with all of the folks out on the Cape who I would, you know, at some point be working with, referring to. Right now, Bay Cove, which is out of Hyannis, is one of the ones that has openings. They've been amazing, so that makes me feel better, because that is for sure one of the areas that it's just unheard of, finding a psychiatrist here. So, but it's a process. You can't just go there and see a psychiatrist. So, it's a whole process of applying and, seeing what your needs are. And they do great wraparound services, which means that they have medical, they have mental health if you need somebody to check in with you. So that's been a really great resource.
Great.
Thank you.
You're welcome.
And one of the, a flip side of mental health or often co-occurring issue is with substance use. So substance use exists on the Cape. It exists pretty much everywhere. Is that something that is a concern in this community? Is there anything in particular that is a concern when it comes to substance use in Chatham?
I think that there's not much public information about what the status is. There was a very well-known incident where somebody was arrested on Main Street and was apparently, according to the article, a drug dealer and had cash and money, and I think it surprised everybody. So I think people are wondering, well, do we have a problem here? How many overdoses do we have a year? How much of it is in school? And I don't think actually people know much about it. I don't know how you get that information, frankly, if you wanted it in this.
It's not publicized.
I mean, if you really wanted to do a proper community health needs assessment, there ought to be a whole additional piece based upon a rounding up and an analysis of all of the available data. I mean, everything from, death records to birth records to causes, mortality, morbidity. I mean, and the problem with trying to do that in a town like Chatham is the small numbers problem. We don't have enough population to make sense of it, because one event in a small number of people will change the rate tremendously. So I know there's limitations to that, but there ought to be a way to maybe take a broader view of the county as a whole and benchmark some of our health indicators against the rest of the state. I don't know if you could do that, but
That is a component of this project, and we're looking at each of these individual towns on the Lower Cape in comparison to Barnstable County and Massachusetts as our benchmarks.
okay.
Diane, did you want to talk about our recovery coach and what we're doing here in Chatham?
Yes, I did. So another thing that we have here, another resource that we have is we have somebody by the name of Kelly Conley. She comes to the police station every Wednesday from 12 to 4, and she's busy. And you can walk in or you can make an appointment with her. And I will put her information in the chat so that you guys have access to it. But she's contracted through the town, so she's there every week, and she responds to emails for people who may be in need of any kind of support or who are ready for treatment, the whole gamut. So that's another great resource that the town has that we're trying to get out there as well.
Great. And another component of this project is, so we're looking at community health. So that includes doctors, healthcare, but in addition, it's also looking at the broader sense of well-being. So in public health, we talk about the social determinants of health. So that's things like housing and food insecurity, those other pieces of a person's life that, if somebody doesn't have housing or they're concerned about putting food on their table, they're probably not worried about not being able to find a PCP. So I kind of want to move into those social determinants of health. And I know one of the big ones in this community is housing. Is there housing in Chatham for people to come live here?
No.
Depends on how much money you have.
Okay.
So part of the issue with the drug problem is that a lot of the people that are suffering from drug problems are people who are in construction and fishing and trades like that, who get injured and then get treated with, used to be OxyContin, and then end up with a drug problem. But those people don't live in Chatham. There's no place for workers to live in Chatham. So if somebody's a carpenter in Chatham, he's living in Plymouth, or he's living in Hyannis or Yarmouth, and so we would think, oh, we don't have a drug problem here, because there really aren't that many young people, working people, who live in Chatham. The median age is 65 in Chatham, and the median income is, what, $90,000 a year?
I think
Yeah,
that,
we have a drug problem, but those people go someplace else to live.
I don't think that's necessarily true. I think there's a lot of alcoholism
Oh, well,
and drug issues with people that you may not even know about. So, and one of the things that Kelly, our recovery coach, can do is family members can go to her and say, you know, I'm worried about my mother, my brother, whoever, and help that, Kelly can help them, you know, find services, make recommendations. So that's a really, a great program that we have going. You know, I think we do have drug problems, maybe not the same level as they may have in other larger towns on the Cape, but I think it's a little bit more of a hidden thing. So, and alcohol is a drug problem. And we do see quite a bit of that, especially, you know, with some of the older people that may be living alone and have issues, and, you know, we respond.
I think the housing thing is very real, though.
But yes.
I remember a couple of years ago, I was in my neighborhood, and there was a police officer doing a detail, like they were doing road work or something, and he was, you know, standing there letting cars go by. And I start chatting with him. He was a Chatham cop. And I said, where do you live? He goes, I live right in Harwich. And I said, well, that's great, you know, that you have enough income, you know, to afford to buy a place. And you have kids? He goes, yeah, I got 2 kids. And then he starts explaining to me how it is that he can afford to pay for housing nearby. He says, my salary is only half of what I make. I have to work 60 to 70 hours a week in overtime, which essentially doubles my police officer's salary. So then I can get up enough that I could afford housing in the, you know, in this part of the Cape. So, but that's how he does it. He works 40 hours, and he works another 40 hours taking overtime work through the police department.
But right now, there are 2 affordable housing plans in process that are coming into the town of Chatham. So the town is working to find affordable housing for people.
A similar community to Chatham is Nantucket. Nantucket just passed a bylaw that basically makes all short-term rentals in Nantucket illegal. And the state, one of the major stated reasons for that is that there's no place for workers to live in Nantucket. The police and firemen are often sharing apartments and just, you know, crashing in apartments. So there's no way you can find a place for a worker to live on Nantucket. And that's pretty much the way it is in Chatham. We now have over 30% of all property in Chatham is short-term rentals. Every house that sells for under $900,000 is very likely to be turned into bought up by somebody and turned into a short-term rental, either a corporation or a private individual, and make it into a short-term rental. And so there's no year-round rentals. You're not going to rent a house for $3,000 a month if you can rent it for $8,000 a week. For a rental season, which is now not 10 weeks, it's more like 10 months, April through January. So until we do something about the short-term rental situation, it's going to be very hard to provide housing for workers in Chatham.
We do have a housing authority in Chatham that does provide housing for for some folks, but again, there's usually waiting lists, so it's difficult. It's just a fixed number of units. And as Carol said, the town is, actively trying to construct more housing. It is a big issue. It's a problem finding police and fire people that can
Right.
work here, even to fill town jobs. And it's just difficult to find any place to live on the Cape. So it's definitely an issue.
I bought a new stove from a local appliance store, and a couple of young men, a week or two later, came and delivered my new stove. And I saw them, and they were coming in, I was chatting, were you guys, you live nearby? And he said, no, we live in, no, what is it? Fall River.
Fall River.
I said, you live in Fall River, and you drive every morning to Harwich to your appliance work job, to then spend the day going around Cape Cod delivering appliances. Then you get in your car at the end of the day and you drive back to Fall River. And they said yes. So, just another example.
Thank you. I appreciate the example. It really helps to paint the picture. I have a question about the short-term rental issue. I've heard from a few community members that they might be able to get a rental for the wintertime, but then they lose it when it becomes the season. Does anybody have a sense of where do those people go? So they lose their winter rental, and then what happens?
They become the homeless for the summer.
Okay.
No, I'm joking.
Oh.
I don't know if that's the case, but I hope it's not the case. But they're between a rock and a hard place.
Yeah, they scramble to find something else that's for this, for during the season, because people can get so much more money for their vacation. Oh, somebody.
Camping,
I've heard of people doing that,
yep.
camping for weeks.
And the main thing too, for young people, a lot of them are sharing houses. You have like 4 or 5 people splitting the rent and able to work here in order to stay on the Cape and work here.
Huh.
So that's.
They
that's-
sublet,
Yeah, well-
space from an
Yeah,
apartment.
well, my son's living with 3 other people and splitting the rent.
If they can find a house.
If you can find it, they found
will
a
rent
house. But
year-round.
the rent is $3,200 a month. So they split it 4 ways. I mean, you can't afford that on your own. So this is what's happening. If you want to stay here, you have to, I know several people that went to school with my son, same thing. They live in houses together, in a house together. That's the only way they can afford it.
Does anybody have concerns about that, for what that does to the fabric of this community? You have people that may potentially be camping in Nickerson Park, or young people feel like they can't afford to live here, so they might leave. Is there concerns about what that will do to the community in the long term?
It'll fragment.
I think there are concerns, but also if people are going to rent during the season, they're going to rent during the season. And that's usually how they make a lot of, they can rent for $4,000, $5,000 up a week. So it's always going to be there. It's always going to be a problem, I think.
You mean the
when you're-
money-making aspect?
Pardon me?
The opportunity for an existing homeowner to rent their space.
Exactly.
Cash out and make 40, 50,000 a summer
Right.
or what have you.
Absolutely.
And that's why some communities are doing something about it. Nantucket, Bar Harbor, Maine, there are places that are deciding this can't go on. We can't have half of the property in Chatham, short-term rentals, and still have a community.
You don't have,
I
you
think
don't have a neighborhood then.
it changes the makeup of the community from families with children and schools and community centers and to a community that's very busy in the summer with a lot of tourism and a lot of wealthy people who may only use their homes a few months a year, and many of them are being rented out as short-term rentals. So it definitely changes. I mean, again, I don't live in Chatham, but I see it all over, and I see it in Chatham, that it changes the makeup of the community, I think.
For the worse.
Oh, it totally
Yeah.
does. It's where a tourist destination.
And again, you can't find, police, firemen, you want those people in your community and knowing who, them. And if they have to travel from Plymouth and work here every day, that's just makes it difficult.
We all know this is a problem, but in order to fix the problem, you would have to have a bylaw get through the, regulation get through the town meeting. And when a very high proportion of the
Right.
property owners in Chatham are making $8,000 or $10,000 a week renting their property, they're not gonna rent again, they're not gonna vote against the short-term rental industry. So it's a big problem.
problem.
And, one of the reasons we have such a low tax rate in Chatham is we have no kids.
Right.
We have no children in Chatham. The elementary school, it's like 50 kids rattling around in the elementary school. And we have one of the lowest tax rates in New England because education is a very large expense for a town. So the good part about this whole problem is I'm paying a third the property tax I pay when I was living in Connecticut and had a house that cost 30% less than what I'm living in now. It's so, if we develop a lot of housing for young people, our tax rate's gonna go up.
But one of the ideas of stricter short-term rental regulation is that if you restrict that, you can get more year-round housing. That I think is a hope and a thought.
Yeah.
And I think the town is in the midst of a couple of big projects, and density is the big issue that's being discussed. More density to create housing for the workers and, 1 and 2 bedroom rentals perhaps, with reasonable rents. That's a part of the discussion, so we'll see what happens there.
Yeah, I appreciate that insight. Thank you. Are there populations in Chatham that are maybe more vulnerable than others? So it sounds like there's a small number of kids, large number of elderly. Are there, is one part of the population or another more neglected, vulnerable than others? Even in terms of income. So are lower income people here more vulnerable?
I come back to, I don't know a lot of hard data, but I think the elderly who are quiet and to themselves, and maybe they've lost a spouse, and I think that they get kind of hidden, and they're not very capable with a lot of getting access to a lot of these services. To me, that's a vulnerable population. I don't think there's a good sense of how large a population it is, but there's a lot of elderly in Chatham.
Yeah, and part of the problem in Chatham is the elderly don't live in a neighborhood with a lot of other people living around them they've known for 30 years. You're living in a neighborhood and half of the neighborhood is short-term rentals. And there's not really a community there that's gonna look after you, like in other.
And a lot of people aren't year-round residents.
Right.
So they'll come here for a couple months and then their house just sits open, sits empty over the winter.
We live on a street in North Chatham. There's about 20 houses on the street. There's now 5 short-term rentals. And there's about a third of the remainder are summer, summer residents and their houses. So our street is at Christmas time, we're the only house that has Christmas lights on the street. The whole street is dark. There's nobody there.
Anecdotally, I know I don't have data on this, but when I read about there being special days that, for instance, the high school hands out free food, right? Or some other community-based organization has free food day. And then you hear that there were like 200 people came through. No, one of these, it's called like a no questions asked. You don't have to show you're eligible. You just have to show up, and that is an indication that you've got some food insecurity. And when they do programs like that, at least when I've heard the numbers, I've said, holy cow, there's that many people from Harwich or that many people from Chatham that show up voluntarily to get a basket or a cardboard box of food for free.
I think some of the schools offer free breakfast and things like this, and you just.
And that got very popular.
Yes.
Like during COVID
So-
particularly.
And there's, again, no questions asked, and you just go in and
The Chatham Food Pantry
exactly.
is a great organization.
That's right.
You can go there every 2 weeks, you can get 9 bags of food, and it's basically the honor system, you tell them
Exactly.
what your income is. They had one woman driving a Mercedes with gold jewelry, and she told them that her income was $60,000 a year, and they gave her 9 bags of food.
But I think the food pantries will say that they're pretty busy. There are a lot more people there than you'd think. They know who they are. They're the same people that come regularly.
That's
I
true.
mean, they would have, I'm sure, a database. I mean, I don't know if it's probably private information, but it's surprising. And then I think some of the churches hand out food or bring it to people's homes, and you'll hear the people that do that say, you'll be surprised at how many of these elderly, poor people in homes we go to, and you'd never know. So how you get access to that information, I guess is what you're trying to do maybe, but it's real.
The food pantry does a great job with the fishing.
Is there just one
community,
food
too.
pantry in
The
town?
fishing community, basically, a lot of them go to the food pantry all winter, when they go out fishing. And as soon as they start fishing in spring, they don't show up anymore. It's not like they're gonna come in and get free food just because it's there.
Is there just one food pantry in
there was
town?
Well, there's the town, there's the community.
There's another pantry over in Harwich.
In Harwich, but there's one in the church next to the movie theater.
Right, that's the Chatham pantry.
That's the Chatham food.
And there's a bigger one, a Cape Cod pantry, I believe, over in Harwich.
Shireen, would you like to make some
Thanks.
comments?
There's a lot of,
Thank you,
yeah, there's a
Shireen.
lot of assumptions going on about the fishing industry here. And I appreciate everybody's comments. I've been doing a little bit of work with the business I work with on food insecurity on the Cape. And a broad stroke, you can just, as a matter of statistics, 10% of Cape Codders are food insecure. Sometimes as high as school children. Barnstable High School just did an assessment of their food security issues and found that 52% of their high school families are food insecure. So food insecurity is a big issue. It plays along with high costs of living on the Cape factor, but also housing costs. People are putting a lot of more money into their housing costs because they're so high here, and what gets left out is oftentimes food and healthcare. And so there are, there's a lot of, I think identifying is one thing, and I think you should really look to some of the strong statistics that are out there with the Cape Cod Commission has done some work on this. Some of the hospitals have done some work on this, and look at those statistics for what, instead of the assumptions that I'm sort of hearing here. I think that a lot of resources from our own staff at the town level probably have this information at hand, especially Judith and people doing some of the services with the COA. But that would be I think that you could probably assume on the food insecurity piece from what I've read for doing some statistics working with providing food for food banks. Thanks.
Shireen, what was that entity you said you should look at?
Well, I
for
think that
data?
you could probably look at some data from the Cape Cod Commission. And I think that you probably could get a report out from the COA, our COA, on our elder needs that would probably enable you to assess better. It sounds to me like there's resources out there. I think that communications is probably where you're heading and what you need to know. how you're trying to get the word out to people and better service them. There is a unique organization called the Fishing Family Support Services that is located in Massachusetts and has a base office in Chatham that does do referrals of all these kind of services. It's similar to what COA probably does, the same thing. They'll intake for, let's say, health insurance reasons, but will also be able to assess if a family has any needs, any addiction or addiction issues, or if there's food insecurity, or if they need a referral for financial services and whatnot. And that's a free service that's offered not just for fishing families, but for across the board to Cape Codders, especially the health insurance.
Thank you. Nicole,
Thank you,
Shireen is a member of
Shireen.
our select board also.
Thank you. Have a good day.
Thank you,
you.
Shireen.
Okay, so in the interest of time, I have a final question that I would like anybody to feel free to jump in and answer. So if you had a magic wand with unlimited time, money, resources, people, and you could fix one issue that's impacting community health in Chatham, what would that one issue be?
Affordable housing, my vote.
I think we may also have a problem that's come up, and it's pretty widespread nationwide, is air pollution from our airport with the leaded fuel that's affecting citizens, residents in the area, especially young children. And I just heard a program on Sirius Radio about how it's affecting nationwide, and supposedly we will have some unleaded fuel by the end of the summer, but just a small quantity. So I think that's something that needs to come to the forefront to help our environment and the health of our community.
I would probably come back to say, looking after the elderly that are a bit hidden with all their problems, and there's more of that than we know of. And I would agree that affordable housing would get at a lot of these things, and I think the town's moving in that direction.
Question is, fast enough?
Excuse me?
Fast enough?
Anyone else, if you had unlimited resources and could change one issue in the community? Anyone who's here, anyone online?
That's a big question.
It is a big question. It's a lot of power to have.
Yes, there is.
Is there anything else that this group would like to share in terms of the community of Chatham itself? And, oh, yes, go right ahead.
I'll be very brief. A few of the things you...
Take all the time you need.
Sorry, Tom Clark. I'm a retired environmental litigation attorney. Live here in town. A few things that you were talking on a phone number to call in for services. Most towns in Massachusetts, it's 311 is the magic number that's used. If you want to get on your on the 911 list, so the fire department knows how to get to you if they get a call or something like that, go by the fire department headquarters. They have the forms there. I used to pass them around to members of the men's club, so I know how it works. And you fill out the information, you give it to them, they put it into a database. And that's, if anybody has to come to your house to help, they have access to the database. They have phone numbers, who to contact, who you want them to contact if there's something that happens to you and so on. So I just mentioned that in passing.
Who provides that again? Could you?
The fire department has the forms, and then they manage the database. At least they were as of 3 months ago. It may have changed, but. Okay, I want to plug wastewater surveillance, which I know is not what you're talking about, but I think it's really important. For people that aren't acquainted with it, wastewater surveillance has become very trendy these days. It's basically you're monitoring for the presence of infection within the community. It's a really inexpensive way to get information. I mean, really inexpensive compared to any other methodology that you would normally use. It's also good for tracking infections in the community and for screening particularly if you want to focus on find out where a particular problem is. It's a good way of focusing down, so you actually can pick out the building or the house that is providing or seems to be the source of the disease. It's used a lot in colleges when they want to find out which dorm room or dorm is providing the latest infection that's spreading through the student body. And Pat has left, but I can't say enough good things about Pat Burke and what she does for everybody in town, especially on the Part D. I've saved a bundle through her advice. So I can't say enough great things about it. Now, I'm going to make an assumption, and you'll forgive me for my arrogance on this, but I'm going to suggest to you the kinds of diseases that I think a wastewater program in the Cape should focus on, just because they're common, they're very virulent, they kill a lot of seniors, and so it's helpful to focus on that. So let's just run down the list. COVID-19 we've had a lot of experience with that. There's a lot of new variations that are out there. They don't know how deadly they are or how innocuous they are, but it's a good thing to look at. Influenza is another one that's common. RSV is another thing to look at. If you haven't gotten your RSV vaccination, by the way, and you have grandchildren, go get it before you visit with them. Non-polio enteroviruses. I won't try and pronounce all the names for them, but that's a family of viruses that are, in some cases, extremely pathogenic. I'm sure that Noble and John and so on have a lot of exposure to that kind of stuff, so I'll leave it to them. Hepatitis A is very popular. One that's coming up, just because it's spreading in certain communities, is what used to be called monkeypox, but is now called Mpox. There are two clades, 1 and 2. 1 is the really deadly one. 2 is much less deadly, although there have been reports of people dying from it, from the clade 2 version of Mpox in Los Angeles. Another one that's helpful for foodborne injuries and so on is obviously the good old E. coli, which everybody, if you had a chemistry class, you know what E. coli is, because that was your target organism for whatever experiments you're doing. Norovirus, of course, is another one that's good for food. And when you may have remembered during COVID all the tourist ships that were going in and out, and they all came in with norovirus, and 3/4 of the people on the ship were puking their brains out and so on. It's really awful. Cholera, diarrhea, dysentery, typhoid, polio, giardia, salmonella, measles, all should be the kinds of things that you'd want to focus on, because these are easily transmitted. They're very deadly, especially for seniors. The other nice thing that's good about wastewater surveillance is that it's good for identifying disease organisms that have developed antibiotic resistance, so that when these diseases are popping up, what can and cannot work. So that was just a suggestion I would like to make to the town, that probably the Cape as a whole, or certainly the group of towns that we were talking about for today's purposes, it would be good to have a steady review constantly. Wastewater is a great thing. It's a great information source these days, and it's very helpful for giving you a heads up about something that's coming down the pike that may be a real problem, and we want to get on top of it before it spreads to the community. Thank you very much. Yeah.
Well, we don't have the sewer system attached to the great bulk of the houses in Chatham. So how effective is wastewater surveillance if you've only got 20%?
I think if I played games with statistics, I could probably say that we've got enough to make us a reasonable sample. But that's just my guess.
Yeah. And of course, the surrounding towns wouldn't be at all useful in.
The county has an epidemiologist on board, and I send you guys every Monday her report. They do look at wastewater data from some of our local communities that are 100% sewered, and they do look at such things as COVID and RSV
Right.
and influenza. I don't know how detailed, to the level of the, 10 or 15 diseases you
I try to
mentioned,
just
but-
find this the worst of the worst.
Yeah, but I mean, it's been a very good tool that they've been ramping up with that all across the country since COVID, and I agree it is a very helpful tool.
I don't know, Judy, about the cost, but I do know that as a Board of Health member in Chatham, knowing that we do have a sewage, wastewater treatment plant that now is serving both Chatham and to some degree Harwich residents.
Yeah.
I would welcome having the effluent from our plant collected on a regular basis and incorporated in with the state data. But I don't know,
Yeah, I think,
what's the truth on terms of cost?
I don't know, and I think there's a state or a federal program that you can be involved in, and I think because we don't have the whole town sewered, we weren't eligible for it, but it's something we can look at moving forward as more and more
I
of the
think
town
it's a very good
becomes-
objective to have to
Yeah.
work towards if we can't.
The cost should not be very high because it's just.
I don't
an
think it
RNA
would
It's
be
just
Grabs it.
it's an RNA-based test.
Right.
It's not hard to collect the samples.
Yeah, you're absolutely right. It's mostly our RNA analysis that goes on, which has gotten really cheap.
So Judy, are you aware that the county is doing wastewater surveillance in some of the towns on the Cape?
No, our epidemiologist looks at the data that comes in, I
Mostly
think from the
Boston
state.
areas where you.
Well, they do use, they use Barnstable, they use Provincetown, and some of the other towns on, in the area that are part of the program. I
So
don't know them
there
all.
are some towns on the Cape.
Yeah, I think Nantucket may be one of them.
I'd love for us to get on that if it ever, if and when it makes.
I'd have to look into it, but yeah, I'm not sure we have enough, we qualify, but that's something I can talk to
Right.
the town about, for sure. It's a good tool. The state really jumped on board with it during COVID, because it was,
Or the person in the
actually
county
great.
that's handling it would
It's
know.
brilliant.
Okay.
I mean, she's an epidemiologist, I think she's looking at the data.
Data, okay.
She's not exactly.
Thanks, Tom.
Thank you, Tom.
Thank you.
I live to serve.
Is there anything anyone else wants to share about community health, about community wellness in Chatham? Anything at all that we haven't talked about that someone wants to mention, bring up? Well, thank you all very much for your time and your insights. I really appreciate some of your observations and hearing your opinions. It'll be really, really helpful for putting together this report for this project. Thank you so much for your time.
Do you have a public health degree?
I do not. I have my master's degree in psychology.
Well, you can outsmart them then.
And thank you to everybody who attended, that were here in the audience and also online. It was very helpful.
Thank you very much, Nicole.
Thank you
Yeah,
very much, Diane.
Diane.
I'm sorry,
Nicole.
not Diane.
Nicole.
Wrong note.
Okay, well, thank you very much. All right, so that was our agenda for today. And
Nice.
our next meeting is what, the 27th or 17th? Right, and we'll have some things on the agenda. 32 Mill Hill Road will be on that agenda. There's some new information, we hope.
Positive information?
Well,
You can't.
that's for us to, that's for us to discuss. But there's no minutes to approve, so I can take a motion to close the meeting.
I move to adjourn.
I'll second.
A second, and then we can take a voice vote. All in favor, say aye.
Aye.
Aye. Any opposed? All right, the meeting is adjourned.
Can we discuss if we want to hear?